So in this meta-analysis, we did reconstruct individual patient-level data from 6 phase 3 randomized clinical trials, including approximately 3,000 patients who had advanced non-small cell lung cancer and had received either PD-1 or PD-L1 inhibitors alone or with chemotherapy, or the same combination plus CTLA-4 blockade. And the question here was, does the addition of CTLA-4 blockade helps improving outcome for this patient population? And overall, we found that the addition of CTLA-4 blockade did not improve overall survival compared to PD-1 or PD-1 monotherapies plus or minus chemotherapy in unselected patient populations. However, there were two biologically distinct subgroups of patients who did benefit from the addition of CTLA-4 blockade. Patients with PD-L1 negative tumors, those with a tumor proportion score of less than 1%, had in fact improved long-term outcomes and survival with dual immunotherapy, with 5-year survival rates which were doubled 17% versus 9% compared to PD-1 or PD-L1 monotherapy. The second subset of patients who did benefit from the addition of CTLA blockade included patients with STK11 mutations. Loss of function mutation in these genes are fairly common. We think that 15 to up to 20% of patients might have one of these mutations. And these mutations usually confer resistance to PD-1 monotherapies. And so in this study, we did see that also patients with predicted loss of function mutation in this gene derived significantly better survival when treated with dual immunotherapy, and therefore PD-1 or PD-L1 blockade in combination with CTLA-4 inhibition. These findings overall suggest that dual immunotherapy may not be necessary for all our patients, but it could offer clinically meaningful improvements in survival in patients with PD-L1 negative expression, as well as in patients with STK11 loss of function mutations. Clinically, these data reinforces the importance of biomarker-driven treatment selection in advanced non-small cell lung cancer. Cancer genomics is not only essential for identifying those patients who are eligible for targeted therapies, but it also helps guide treatment selection of the most effective immunotherapy for each individual patient.